please. My name is Dr. Green. We are here to talk about thyroid disease this evening. And what I like to do is always get a handle on where my audience is coming from. How many of you have been diagnosed with a thyroid problem? Okay, all of you. Okay. How many of you are on medication? Okay. How many of you have been on medication for more than a couple years? Okay, all right. And you are here, can I guess, because the medication isn't fixing it. You're still having symptoms, and you're looking for maybe another solution.
I said I'm happy. Yeah, I mean, I've been doing this for 20 years.
Sure. You're supporting her.
Yeah.
Yeah.
But
you're suffering, but you're supporting her.
Well, I can learn.
Yeah, absolutely. Sure. If there's one thing you guys would hope to learn tonight, what would it be?
What's wrong?
Okay. So we will talk about your thyroid. Actually, you're told you have thyroid disease. You're put on medication, but a lot of times they don't do much more than that. They kind of leave you in the lurch as far as what's actually going on in your body. I will touch a little bit on biochemistry. I'm not going to bore you, but I just want to give you enough to understand how your thyroid works and how much it impacts, and really, more importantly, why it's damaged, why you're having these symptoms in the first place. And we'll really emphasize that as a majority of our talk. If there's one thing you hope to learn tonight, what would it be?
Exactly, as you said, what's going on. I mean, the military found it on me.
Okay.
And I just, they keep on switching my medications after blood draws.
Sure.
To higher or lower dosage.
They can't ever get your TSH regulated properly.
That's correct.
Yeah. Okay. So I will probably answer the question why they can't do that tonight. And we're going to give you a little bit more than that. How about yourself?
I would like to know what the difference between the T4, T3, and the TSH.
Okay.
And I guess the differences between that, why you need to know.
Sure. Absolutely. Yeah. It's really important that we know what they are. How many of you are on a Synthroid or a Levoxel or levothyroxine? All of you. Okay. So you're all on a T4. Right. So we're going to talk about why you're on that versus some of the other options that are out there as well. How about yourself? What do you hope to learn tonight?
I would like to know if there's any ways to alleviate some of the symptoms that the medication is not alleviating.
So the big question that I'm going to answer for you is the medication doing what it's supposed to do? Why are you actually suffering? And what we're going to teach you is that the medication that you're taking is not actually addressing the cause of your problems.
I do have a question.
Yes.
I've been on the same dosage since I was diagnosed 16 years ago.
Okay.
And there's many family members who are on thyroid medication, and it keeps going up gradually.
The first question I got to ask you is, are you on that same dose, but your doctor is still checking it, or have they just kind of left you in the lurch?
Still checking it.
Okay. And they say that your levels always look normal.
Yes.
Yeah.
Okay. Yeah. So we're going to talk about what that normal means as well. Okay. All right. With the two of you, I'm going to go ahead and get started. But good evening. Definitely. If there's one thing, Steve, if you don't mind, that you hope to learn tonight, are you a thyroid sufferer? You were just diagnosed?
Yes.
Okay. If there's one thing you hope to learn tonight, what would it be?
Treatment.
Okay.
And the various things that can be done.
Yes, sir. Absolutely. Have you been put on medication at all?
Yeah.
Okay. So, we'll talk again about where medication can play a role, but a lot of what we're going to emphasize is things that can be done either in spite of the medication or instead of. And unfortunately, the reality is many of you cannot get off your medication. If your body is not producing hormone, so if you're hypothyroid, then you need to get that hormone from somewhere. But what I really need you to understand, and I'm going to throw this comment out there now, is whether or not your body's getting that hormone, whether it's from itself or from a pill, doesn't have a whole lot to do with what it's doing in your body and how it got damaged in the first place. And that's the difference. So, I am recording tonight's lecture. We do record these lectures. They are available on our blog and our website and YouTube. We also have them on DVD. We're constantly updating them as the material comes through. But I want to give you guys a little background on myself. One more time, my name is Dr. Akiba Green. As you all came here to this evening, you walked into an office that said Integrative Health and Chiropractor. And I love talking about somebody like myself who does these lectures every week on thyroid disease. Why is he a chiropractor? You think an endocrinologist, you think, where's the connection? The reality is chiropractic as a healthcare discipline is really primarily a whole health discipline. We don't use drugs, we don't use surgery, but it's a relationship between all the different organs in your body, particularly the spine, the nervous system, the brain. For a lot of doctors, when you think back pain, neck pain for people, but it's more, a stereotype than it is a real treatment. More importantly, my particular passion goes well beyond my 4 years in chiropractic school and 4 years in undergrad. I have 3 fields of study that I've gone through. First and foremost, I am board certified in integrative medicine. I've gone through a course of study, and that's something I'm very proud of. Number 2, I am board eligible as a clinical nutritionist. I've gone through another 300-hour program, including completing an organization, Functional Medicine University, which is a postgraduate program that's sponsored by a medical school up in the Northeast for clinical nutrition hours. It was 200 hours of that plus another 100 hours allows me to sit for a diplomate in the American Board of Clinical Nutrition, which is only available to MDs, DOs, and DCs. Third, I'm also involved in the Carrick Institute of Postgraduate Studies, working towards a degree in chiropractic neurology. My associate, Dr. Draper, who's here with us this evening, is a chiropractic neurologist, and what this is a field of study where you go through, again, hundreds of hours of postgraduate training to learn how the nervous system actually interacts. And you go to the neurologist, and they diagnose you, and they say you have a condition. And that's where they leave you. What chiropractic neurology or functional neurology does is it says, we now have that condition. How do we rehab it? How do we fix it without having to rely on a symptom management? What I do is I practice functional neurology and functional medicine. And when we talk about treating the thyroid, I've been very fortunate to train under 2 doctors. Dr. Mike Johnson, he's an autoimmune specialist in Appleton, Wisconsin, and Dr. Datis Karazian. And this is a name you guys should all learn. And if you end up meeting with me, you will learn, and you'll get a copy of his book. It's a fabulous, fabulous book. It's called Why Do I Still Have Thyroid Symptoms When All My Lab Tests Are Normal? He's one of the top thyroid experts in the world. He has a practice in San Diego, and he's a really, really smart guy, and I've learned a lot from him. But the whole key thing is we're here to talk about how can I help you. My goal, number 1, the main goal that I have for you guys tonight, the top thing, I'm here to reinvent your life. It's really that simple. You've all been told that you have thyroid disease. You've all been told that you have to take a pill in most of your cases. The absolute reality is none of you were told why you had that thyroid disease. None of you were told what happened in your body to lead to it. And I'm here to give you that information and to talk to you about how you can fix it. Every single person that I see that I come in contact with, it's my job to improve your life. How can I add maximum positive impact? I've recently committed to a field of study through the University of South Florida Medical School. I learn a lot, and you're getting that feeling. Come on in, you're good. The way I help you, and I'll talk about this a little bit more when we talk about why your doctors are failing you, is I learned. And it's this year, 2012, I went through 300 hours of continuing education so I could become a better doctor to help you guys. USF's medical school has a program that's sponsored by the AMA called Integrative Cancer Fellowship. And again, the whole goal is how do I help patients? I don't care whether it's a patient that has thyroid disease newly diagnosed, or is a kid who has trouble with constipation, or is a patient who has stage 4 esophageal cancer. There's commonalities with all of these patients. And the issue is how can we help their body function where common medicine has failed them. The most important thing at the end of tonight, I'm going to give you guys an exit strategy. What can you do to make a difference in your own health? And as we get started, we're going to talk about your thyroid. A couple of you asked me, what's actually going on with your thyroid? We got to talk about symptoms if we're going to do that first. And just so you know, I'm a visual learner. I have this PowerPoint here, but I also believe that listening and seeing somebody write helps as well. So my handwriting may be atrocious, but I always speak what I'm saying, and it'll always be up here as well. But I believe that way you've learned it 3 ways. All right, when we talk about the thyroid, first and foremost, the biggest thing we're dealing with is fatigue. Patients come in, they're tired. A lot of times this is how diagnosis occurs. They don't know why they're tired. Their body's worn down. Weight gain. It's another big reason. January, we'll see a bunch of our workshops probably be filled with people who may have a thyroid problem and they're worried about New Year's resolutions. And again, we talk about even on a low-calorie diet. How about even a patient that works out 7 days a week and the pounds don't change? All their friends, they do one of these, big diets, Biggest Loser type diets, and all their friends lose weight, and they don't. So you say maybe there's a thyroid problem going on. Morning headaches. As the day goes on, they get better. How about depression? Brain function is a huge, huge correlation with the thyroid. I see patients with Alzheimer's, Parkinson's, some different pretty tough neurological conditions, and usually the thyroid is involved in how their brain is functioning. One a little bit more common, constipation. Okay, GI problems. This is another big area. I know. He's been there a while. Stomach aches, gas, bloating, acid reflux. Anybody here been diagnosed with reflux? Okay, so there's a condition that I'm going to tell you. Don't write it down now. I'll give it to you later. But it's called hypochlorhydria. It's a lot more common than acid reflux. And I believe that most reflux problems are misdiagnosed as too much acid, when in reality there's too little acid in your stomach. Our acid tends to deplete as we get older, and what happens is we eat the wrong food, and we end up refluxing the food itself. The good news is there's simple blood tests that you can do to look for this. And the treatments are not proton pump inhibitors. It's not what the purple pill they put you on. You actually want to do what your body needs to improve. So how about cold weather sensitivity? You talked about poor circulation, cold hands and feet, especially this time of the year, but it could be July. Your hands are still freezing. Temperature regulation is a big thyroid thing. Muscle cramps, restless leg syndrome. Okay, these are two big things we see as well. Even neuropathy, I'll throw that out there. We see a good bit of people who have burning in the feet or hands. And again, the thyroid is involved with those conditions. You get sick easily. When you get sick, you stay sick forever. But you know what? Some thyroid patients are the exact opposite. You never get sick. Everybody in your family gets sick, but you. This isn't always a good thing. Because while your immune system may be so strong that it fights off the common cold, there's a chance that it could be attacking your body as well. And we're going to talk about autoimmunity a good bit today. How about your slow healer? Circulation. That's a big thing we talked about. And you know what? No matter how much sleep you get, you're still tired. 6 hours, 8 hours. I've got patients that wake up and then go right back to bed. Just the fatigue that's there, and the sleep doesn't help it. Itchy, dry skin, dry, brittle hair, especially the lateral one-third of the eyebrow. So, all these symptoms are really classic for thyroid disease. And when I say thyroid disease, I don't only mean hypothyroidism. It's important for us to keep in mind that there can be patients who have an elevated thyroid function, Graves' disease or hyperthyroidism, who actually are not skinny. Okay, there can be somebody who is hypothyroid who is thin. So the classic, typical picture that your doctors, it can't be your thyroid, you don't fit the mold, wrong. That mold, didn't read the textbook that you were built on. Your body is unique and it has its own unique problems with it. And, every cell in your body has thyroid receptors. Everything is impacted by your thyroid. So if you're going to address it, you have to talk about, what's causing the thyroid to break down? I know most of you here are looking for another solution. We're all sick and tired of going to the doctor just to have them tell us there's nothing wrong. The classic patient comes in, and this gets under my craw. It really does. I get so upset when I read a note from because I'll get all the records when a patient comes in, and the notes, their primary doctor or their internist saw them, said the patient has pain, depression, reflux, GERD, previous cancer, hysterectomy, thyroid symptoms, insomnia. Everything looks good on labs. I'll see them in 6 months. It's like you're saying right there you have all these conditions, but you're saying there's nothing you're going to do for them. Why even go? Some of you have had these conditions for many, many years. 20 years, 16 years. And, you're newly diagnosed. You can look next to you and you can say, hey, what do you have to look forward to? The reality, the absolute reality, is your doctors don't know what they're doing. They don't. If they did, within 6 months of getting diagnosed with thyroid disease, you would be cured. Let's be absolutely clear about this. The reason they don't know what they're doing is first and foremost because they don't read literature. What your endocrinologists or your family doctors are doing is what they learned in school 15, 20, 30 years ago. And in a modern insurance-mandated world, there's simply no time for them to go from patient to patient to patient and then get 300 hours of continuing education that year to learn about the newest research regarding your thyroid. So they're learning what was, taught to them in school. And the textbooks that I have, you're talking, I got those textbooks 10 to 15 years ago, and those textbooks were written 20 years before that. So it's information. Literally, some of the information that we know in there's muscles that were discovered after I went to chiropractic school. That's kind of crazy to think about, but that's how old this stuff is. And yet, your doctors are relying on that. Or worse, They're relying on what the drug reps are telling them. You know, here's a new study, here's a new pill you can use, without actually doing any research on their own. It's quite simply, it's outdated information. If we're going to help you, we have to identify what's causing your dysfunction. And, you know, like I said, they're never going to get you better, because what you're dealing with is not just thyroid disease. I want you guys to all write this down. Every single one of you is suffering with what we call a web of physiological dysfunction. Not one of you has just thyroid problems. It's physiologically impossible. We talk about everything your thyroid impacts. When I talk about a web of physiological dysfunction, what I mean is you have problems in every different part of your body that are contributing to the symptoms that you deal with. And you may not have every single one of these issues, but there's a combination that you have that's contributing to your symptoms. And again, we're talking about everything that deals with, you know, the brain. You have brain problems. You have nerve problems. You guys obviously have a thyroid problem. Your gut is a huge area we're going to talk about. Even if you have absolutely no symptoms. Does anybody here have no GI problems at all? They feel perfect with their constitution, if you don't mind saying. Okay, all right. You have a GI problem if you have a thyroid problem. You have a constitution problem. You have a gut problem. Okay, if you feel like it's good, you have a problem there because your thyroid is not working right. And actually I'll tell you where that's involved in a few minutes. But you know, memory. How about memory? Short-term memory loss. Yeah, sure. Call it brain fog.
Does age have anything to do with it?
Let me answer that for you. The real answer is no. But what I will tell you is if you are sick, if something is not right, if you have this web of dysfunction, and you have this web of dysfunction for 2 years, you may not be as sick as somebody who has this web of dysfunction for 30 years. So age did not cause your problems, but having a problem for a long time made it worse. Does that make sense?
Yeah.
That's why somebody who's in their 60s, 70s, or 80s can still be out playing tennis every day, and somebody else who's in their 50s or 60s is on death's bed. Because what their body has done has contributed to the conditions that they're in. The age itself is almost irrelevant. It's what's happening inside. And what we call that a metabolic problem. It's where your insides, your metabolism is not functioning the way it's supposed to. And you know, the reality is they don't make a pill for that kind of problem. And if we talk about that, you know, we're going to talk about your web of dysfunction. And I had you guys fill out all this paperwork, and I'm going to go through this with you, and we're going to figure out what your web is, so we can figure out how we're going to help you. Where is your thyroid problem coming from? But I got to first start with that last page. Remember, I said you guys all had brain problems. You probably were looking at me. How does he know? What's he talking about? When we talk about the brain, I'm going to talk about 4 areas. First and foremost, we're talking about something called the frontal lobe. Now, the frontal lobe is where all of our executive function is. What makes you you. If you've noticed, your personality has been changing. Depression, anxiety, irritability. Other changes are occurring. It's happening in the frontal lobe. Everything from ADHD to concentration to memory. It's a huge area. You know, you get more irritable. You cut people off. You know, you're not. Your wife says, you know, you're not who you used to be. Your husband says you're not who you used to be. I mean, it's just, you know, the frontal lobe is a huge area in our brain, and that's where that's happening. Now, another one, we talk about memory. The hippocampus. It's a big word. What it is a part of our brain where all of our memory is stored. So if you have a brain problem, if you have a memory problem, this is where you have a problem. And that's what I want you guys to understand. If you have a memory problem, the memory problem is occurring in this one part of your brain. If you guys have a problem with pain, how many here have pain of some kind? Aches, soreness, numbness? Sure, a good bit of you. And I see this a lot with thyroid sufferers. All of our sensory input, every bit of symptom that we feel, anything we feel goes into a part of our brain called the parietal lobe. It's on the side of our brain. The parietal lobe is really, really important because if it starts to short circuit, we're going to hurt. You know, the biggest example I can give you, again, is with a neuropathy patient. You know, I've got a patient who, every month before he came to me, he had to spend $20,000 through his insurance for an IVIG injection to help his neuropathy. Every single month. They actually paid for it. I couldn't believe that. You know, in literally 6 weeks, he's 30% better. You know, and he's pushing his injections out to see how long he can go. And the key thing is, his problem is not with his feet. His feet burn all the time. But you look at them, they're not on fire. The reason why he has neuropathy, he feels that burning in his feet, is because the parietal lobe is malfunctioning. And it's sending a signal out that something's wrong. That signal is what he feels as pain. So when you hurt in your neck is not where that pain is coming from. There may be a problem there, but the pain is still coming from your brain. And what that means is that it can be changed, it can be modulated, it can be improved upon. And that's important when we talk about where some of your pain symptoms are from. Now, one other area I want to mention to you, and this is an important area for you, is the hypothalamus. The hypothalamus is really, really important for all of you. Who here has not heard of the hypothalamus? All of you have heard of it. Okay. You've not heard of it. Okay. Have you heard of the pituitary gland? Okay. You're all tested for TSH. Okay. TSH. Okay. That's made by the pituitary gland. The reason that's made is because the hypothalamus in the brain tells it to be made. It makes a hormone called thyroid releasing hormone, TRH. I'm going to get into that in a couple minutes. But the hypothalamus is the first part of thyroid function, and it's in the brain. So if you have a brain problem, then you have a thyroid problem. And, we talk about these problems. There are not pills to fix them. Parietal lobe. We talk about that neuropathy. Lyrica, Cymbalta, amitriptyline, gabapentin. These are pain medications that they use. And the patients who come in who have neuropathy, they don't work. They may dull your senses and may make you, feel a little better. But most of those patients, the pain's still there. They still hurt. You have short-term memory loss. There's no pill that they can give you to bring your memory back. When we talk about your brain, I want you guys to look at that page 4, the ones that had all the yeses and nos on it. When you filled this form out, if you have more than 5 yeses, good evening. If you have more than 5 yeses on this form, you have a brain problem. So we got a few of those.
16.
Okay. How are you? We're on page 4. I know you just got here, but what we're talking about is really how the brain impacts everything. And what we're looking at with this is, what the brain does. If you've got more than 5 yeses on there, we know your brain's not functioning right. We already know there's a problem there. And the brain sends a signal, an electrical signal, down your spinal cord. That electrical signal goes to every part of your body. It goes to your thyroid gland. It goes to your spine. It goes to your hands and feet. It goes to all your organs. And so if we talk about where your conditions are talking about, or are coming from, and I said, you're suffering from a web of physiological dysfunction, your nerves are going to these organs, and we have to talk about where they're malfunctioning. That's your web. So we are going to get to that web in just a second. What I want to do is I talked about the hypothalamus. I want to talk about basic thyroid physiology. Now, you guys were told you had a thyroid problem. Many of you weren't told what that actually means. I talked about how the thyroid impacts everything. It affects so many different things. But if we're going to improve you, we have to understand how you got there. So I want you all to take a scratch paper. No, just kidding. Don't write this down. I'm going to break it down. It's really, really easy. Okay? Everything starts in the brain. Okay? The hypothalamus makes a hormone that tells the pituitary gland to make something you've probably all heard of again called TSH. TSH tells the thyroid gland to produce hormone. Now, most of you that got here earlier said you were all on a T4. We're talking, it's a synthetic T4 like Synthroid or Levoxyl. There's 2 hormones that the thyroid gland makes, T4 and T3. The thyroid makes 93% T4. So what that means is the vast majority of what your gland is actually making is T4. Only 7% of what your body makes is T3 right out the gate. However, and this is important, T4 is not usable by the body. I want you to digest this. Because you're on a pill that's T4. Your thyroid primarily makes T4. The reason it's not usable is it has to convert into the active form at the cells where it's working on. So T4 has to be transported. It hops on a taxi cab, thyroid binding globulin, and it goes to peripheral tissues. Those tissues convert T4 into T3. So whether you get T4 from a pill or your thyroid gland is still functioning and making it, there is a difference. One is obviously better than the other. The body knows best. But if you have to get it from a pill, that's not the problem. The problem is what your body's doing with it. It has to convert 60% of T4 into T3 in the liver, 20% in the gut, 20% in other tissues like the parietal lobe. How about the pancreas? How about the ovaries or the testes? How about the adrenal gland? All these other areas that convert tissues. And once it's converted, T3 then hops back on a taxicab and goes to the cells, and the cells have to use it. So if we talk about thyroid condition, there's many different areas that led to your thyroid breaking down. What this tells us is that you've got production of TSH, you've got production of T4 and T3, you've got conversion of T4 into T3, and then T3 uptake, T3 being used by the body. When your doctors are checking TSH, how many of these are they checking? One. Yeah. When they check free T4 or total T4, which they may do, how many are they checking? 1.5. Not even. So, to answer your question about T3, and I'm going to get into a full test that we do later, but you have to know what T3 is because it tells you if T4 is converting. If T3 levels are high or low, it means that your body is or is not. It can be too high. I see this with patients who have an issue where T3 can be too high and then your body doesn't use the hormone. So everything looks great. Your hormones look wonderful in labs, but your body's cells aren't willing to accept it. Usually that's an adrenal stress or hormone issue. Talk about people on birth control or HRT. How about those pellets, the bioidentical hormones that you see on TV all the time? Those can really mess with how your thyroid uses its hormone. And I'll talk about how that happens in just a second. Does that make sense here? Are you guys a little more comfortable with the basic concept we're looking at here? So what I want to do is we're going to go back to page 2. We got to talk about your web of dysfunction. Now, for those of you that were able to fill this out, that's fine. If you didn't, not a big deal. What I'm going to do is I'm going to teach you what each category means, and you can fill these out on your own, okay? Category 1. How many doctors have you been to for your thyroid that looked at your colon to see if it was causing it? Did you go to the GE doctor for your thyroid? No. If you have any 1s, 2s, or 3s in category 1, you have a colon problem. And this could be contributing to your thyroid. Categories 2 and 3. We talked about reflux a little bit earlier. Categories 2 and 3 are the stomach. I'm going to draw my web out here. The stomach has 2 categories. One category is kind of low stomach acid. One category is typically symptoms of high stomach acid. But even those symptoms usually aren't because of acid is high. I've probably taken off. We've seen close to probably 600 patients in the last year and a half or so, and with autoimmune disease, and of those patients, probably 50% of them, if not more, we've been able to get off of any sort of acid medication. It's nobody needs it. You don't have too much acid; you have too low. And what happens is your stomach either doesn't produce it properly, or it doesn't use it. And if you look at categories 2 and 3, if you have any 1s, 2s, or 3s there, this is something we have to look at. Now I'm going to throw a thing out there for you: osteoporosis. So it gets absorbed in the stomach, calcium. So if you don't have good acid, you're not absorbing calcium. We're going to talk about infections in the stomach. We talk about a lot of nutrients, but when we talk about the link between stomach acid and health, there's a lot of things that it's involved with. How about category 4? This is your small intestine. 90% of your food is assimilated or broken down in the small intestine. If it's not working right, then there's no way you can break down food properly and turn it into energy for your body to heal. And what we're talking about is whether it's an infection or a problem that you have, or how about the patient who had a colon transection, or I see all these patients with gastric bypass. And what they do is they not only cut down on the stomach, but then they cut part of your small intestine out because your body isn't using it properly. So if you have any 1s, 2s, or 3s in category 4, then we're looking at your small intestine. All right. Category 5. Who's had their gallbladder removed? Nobody. Don't let them. Don't ever let them. Gallbladder removed?
Yes.
Okay.
So when gone, what do I do?
I know. Yeah. You need to take bile salts.
What?
Bile salts. Pink salt. Okay.
Pink salt?
Yeah. I can talk to you about it later, and I blogged on it. But what happens is your gallbladder regulates your body's ability to make bile. Okay, that helps your body digest food. Okay, if you don't have that gallbladder, your liver has basically, it can't regulate it. It's always throwing it out there, and it works a lot harder. Category 5 is liver and gallbladder. And here's the thing: I don't know if you filled this section out yet, but what I see all the time is patients who've had the gallbladder removed have 1s, 2s, and 3s in category 5. So you get your gallbladder removed, and you still have symptoms of gallbladder dysfunction.
I was getting tremendous pain, and that went.
I know.
When the gallbladder went.
Absolutely.
That went.
Yeah. So, usually what we're talking about, we talk about gallstones are a reality. You had them. The question became whether there's a way to naturally fix it or not. And obviously emergency medicine is there for a reason, and it saved your life quite possibly. But, you got to deal with the consequences now of what that means. And that's okay. I mean, but your body, the key thing is your liver is so important for thyroid metabolism.
Yeah.
60% of T4 converts to T3 in the liver. If you don't have a gallbladder, your common bile duct and liver has to do all that extra work. Mm-hmm. So it's got a lot more on its plate, which means that it may not be converting your thyroid hormone as well as it used to.
I've got my appendix out.
Mm-hmm.
Since then I've had problems with my body. Is there any link with that?
Well, I mean, talk about it's a piece of your large intestine. I mean, you're just talking it's a piece of the intestine. So, I mean, it's and the question becomes, I had mine taken out as emergency surgery, and I'm celiac. I mean, I've got a ton of issues that I deal with that I've overcome. And the key thing is you need to be able to know what your body's doing, whether it was the appendix itself that led to it, or something else they did in the surgery. I mean, that's a good question. But as we talk about taking these parts of the body out, like I said, they can remove them, and you still have symptoms. They're called the genius of medicine. No matter what you do, they're still gonna be right. We're gonna remove it. You know what? I feel horrible. Well, that's great. You're supposed to. You removed it. Why do I still have symptoms? Well, that's okay. You're going to have symptoms the rest of your life because I did this. And it's we talk about back surgeries. Something obviously that most chiropractors see a lot of, and we help get them so they don't have to end up that route or afterwards they're hurting. 50% of all back surgeries are failures. That's a pretty big number, and yet it's so common. And a good friend of mine's a surgeon with North Carolina, and when I first met him about 10 years ago, he told me, how excited he was, how happy he was with the success rate they had with their microdiscectomies. 38%. Mm-hmm. I'm like, you're proud of 38%. I mean, it's better than the 23% it used to be. I'm like, you're saying that you can go in there and you have a 1 in 3 chance of having a successful surgery, and I'm going to pay you for that? I mean, it just. Here's the thing: insurance keeps bad doctors in business. I want you to say this with me. It's so, so true. I really believe that incompetent doctors are kept around. And all the doctors you're seeing for your thyroid, they don't know what they're doing. They keep regulating it. They keep saying everything's fine, and you're on the same levels, and nothing ever changes, and you feel the way you do. You're not seeing him because he's good. You're seeing him because your insurance covers him. And you got to keep that in mind. The unfortunate reality for many people is if you want to get good health care, you sometimes have to reach into your pocket. And I don't know if it's going to get any better with the changes in healthcare going forward either. Less and less is getting covered. They're more interested in paying for a surgery down the road than preventing or fixing the problem today. There's only one thing that matters in my office, and this should be the only thing that ever matters in your health, and that's results. And you guys aren't getting them. It's really that simple. I want you guys to write that word down, results, at the top of any of your pages, because it's really what we need to make sure that we can accomplish for you. Okay. So as we're looking at your web, we talk about 5 categories: colon, stomach, small intestine, and then gallbladder, liver. I want you guys to kind of circle all those categories. They're all one big category. We call it the gut, the gastrointestinal tract. And here's the thing. 80% up to 80% of your immune system is located in your gut. So remember I talked about you have a thyroid problem, you've got a gut problem? In 1998, we've heard of endocrinology, okay? Their main journal is the Journal of Metabolic and Endocrine Disorders. It's the #1 thyroid journal in the world. In 1998, they had their first article that said that 90% of hypothyroid conditions are the result of an autoimmune problem. So what this means is if you have hypothyroidism, there's a 9 in 10 chance that you have Hashimoto's disease. Hashimoto's or thyroiditis. Okay, it's an immune problem. And the key thing is putting you on Synthroid, and this goes back to whether it's thyroid or cancer or neuropathy or any of these conditions, it doesn't address the immune cause. It just puts you on a symptom. So if we're going to get you better, we got to look at the link between that immune system and your thyroid. The gut and brain connection is huge. So what we're talking about is 80% of the gut is your immune system. Well, even Hippocrates said, look to the gut. You find the origin of almost all human illness. He was thousands of years old. And and we've been saying this for a long time, the father of medicine. And here's the thing, anything that causes an immune battle in your gut will trigger inflammation that can attack your thyroid. So what we're talking about, I'm going to get to the top one last, but we're talking about infections. We call them antigens, invaders. How about bacterial infections? H. pylori, talk about that stomach acid issue, those ulcers, you talk about. Sure. Yep. And I can tell you the current tricyclic medications have a 50% success rate. We add in some additional enzymes, that rate goes up to 80%. There's some research that shows that. I've never seen a patient that I've not been able to get rid of it completely using natural methods. And the botanicals can be as powerful or stronger than an antibiotic that will wipe your immune system out. How about parasites? Like Norman. I love that lake. It's a lake. It's dirty. Don't swallow the water. How about sushi? It's supposed to be really good for you, right? If your immune system isn't strong, you're going to get a bug. And that bug can live in you potentially for years. And all you say is, I'm tired. Or maybe my bowel movements aren't quite right, but they're never that bad. And you know what? It's basically causing that immune system to shift. And you just feel the way you do because it's attacking you. Mold, biotoxins. Got a little bit of experience with this. I've had several patients that have had some real tough issues with mold exposure, black mold. And it's something that, honestly, I've seen some horrible cases where, patients have been through, even a colleague of mine has been through, we're talking 10 different hospitals, in Virginia. Nobody knew how to treat him at all. His whole family was sicker than everything. And it was mold. And it took him figuring it out himself. Doctors aren't trained in how to deal with biotoxins. Lyme disease. It's an ugly word around here because of a clinic that used to be open and a doctor that helped a lot of Lyme's patients. There's not even a consensus. I can bring a test, a Western blot Lyme test, to two MDs, two infectious disease doctors, specialists. One's going to say you have it. One's going to say the same test, you don't have it. There's not even, they don't even understand what the test means. Fungal infections, yeast, candida, all these things, viruses. How about an undergrowth of good bacteria? It's called dysbiosis. Now, how many here have fatigue? Okay, sure, yeah. So 30% of your daily energy comes from bacteria in your gut. So if you have a bacterial problem, you're not making energy. And the big one, I got another stat for you, and this is going to be a freebie for every single one of you tonight. Food sensitivities. I have over 17 papers now on my desk. These are medical papers published in the last 10 to 15 years, recent research, if you will, that correlates a direct link between Hashimoto's, autoimmune thyroid disease, and gluten sensitivity. 100% correlation. Every study that's been done, they take a Hashimoto's population, they've removed gluten out of the population, and their thyroid antibodies reduced. Every single study. If you have a thyroid problem, unfortunately, you have a problem with wheat. You need to stop eating it. And if you do, two things are going to happen. T4 is going to work 40% better. Study shows that. And you're probably going to start feeling a little better. Wheat, gluten. Yeah, as in bread, pasta, soy sauce. Yeah.
Soy sauce.
Yeah. There is gluten-free soy sauce. There is gluten. It's called tamari. And it tastes. Yeah. And unless you have a soy issue, and that's the thing. Unfortunately, for some people, and it's not just gluten. There are 12 foods that have been published now in the literature that are what we call cross-reactive. Dairy is potentially one of them. 50% of the time.
What about yogurt?
That's dairy. Yeah.
No, that's not good for the gut.
Well, honestly, it's not that good for the gut, and I can address that offline. But the probiotic count is so low, it's negligible.
You'd have to eat a lot of yogurt to get them out.
Yeah.
To get better or to get worse?
Better. But it's not even getting. But again, the key thing here. Let's get back on track here. Dairy, soy, egg, possibly gluten-free oats, coffee, possibly. How about corn or even rice or potato? Okay.
What's left?
Well, here's the thing. Of these foods, not everybody has an issue with every single one of them. And that's important. But if you have an issue with any of them, and there are blood tests that we can run that confirm what issues you have and don't have. The science is that good now, we can pinpoint what your food sensitivities are. If you have a sensitivity, whenever you eat that food, your immune system is attacking your thyroid gland. At the end of the day, what choice do we have? Now, the good news is a lot of these foods are not necessarily lifetime sensitivities. We have a condition called leaky gut that occurs in a lot of patients. It's known as intestinal permeability. It's basically where it's a malabsorption, where your gut gets inflammation. It leaches out. We talk about this triggering an immune response. A lot of these foods you're sensitive to because of that leaky gut. We can heal that, and a lot of these foods get easier. I have seen cases, and I'm not going to tell my patients this yet, but I'm going to throw it out there, where if I can get your stomach acid fully corrected, even certain severe allergies and sensitivities don't affect people as much. We're talking a celiac patient being able to take really tiny amounts of gluten and not have a response. I mean, this is some pretty neat research that's being done. So the key thing is, we got to talk about what's driving your gut. That's a big part of this. It really is. Even if you don't have GI issues. If you do, we know we can fix them. But I got to move along. We got some more categories to cover. Categories 6 and 7, blood sugar. Now, several of you said you have memory problems. Blood sugar, if it's low, will kill nerves. It hurts your brain. It hurts your extremities. It causes memory problems. If it's high, that's insulin resistance. That's diabetes or prediabetes. And we know the issues with that. Everything from neuropathy to, how about kidney failure, to, having to lose a limb. I mean, we're talking pretty severe stuff. If I'm going to get you better, blood sugar is one of the largest things that we have to fix. Now, here's the thing. A lot of people don't have insulin resistance. They have what's called reactive hypoglycemia. It's low blood sugar. You can have this low blood sugar problem that, you get lightheaded, you don't eat enough. And it's, talk about how many meals a day do you eat? Well, I skip breakfast. I get lunch every third day. And I usually have a big dinner, so I'm good. No, you're not. Your body's, it's eating itself. And blood sugar is so important to regulate for your immune response. If you've got any 1s, 2s, or 3s in categories 6 and 7, you've got a blood sugar problem. Now, properly regulated, blood sugar is a huge source of fuel for the brain. Sugar and oxygen are what we need to survive. If it's not regulated right, we're going to have poor function. Now, category 8 and 9. This is adrenal function. For those of you who don't know, the adrenal gland sits on top of the kidneys. And if you have stress in your life, the adrenal gland is what's regulating it. It's your stress gland. It releases cortisol and other hormones in response to your stress. And if stress goes up, you know what happens? The hippocampus loses its mind. You lose your memory. The hippocampus gets affected. So the adrenals directly impact, again, that short-term memory. Big correlation there. And, everybody's under the risk of stress. We talk about cortisol can affect us all. Whether it's, the mother of 4 or the retired couple who seems that life is good, or the 15-year-old who's in the IB program or something, in high school. Stress affects so many different people in different ways, and it's a huge thing that impacts all of their health. And it's something that gets completely ignored in blood tests. If you're going to look at stress, you've got to look at it throughout the day, and you have to do a salivary hormone test. I need 4 measurements in a day. So I need to know what your cycle is doing. It should be highest in the morning, lowest at night. And you know what? If anybody has sleep problems, cortisol directly sets your sleep cycle. It's inversely proportional to melatonin. What that means is adrenal problem equals sleep. And it can be fixed. The adrenals also release 2 hormones called epinephrine and norepinephrine. You've got pain. These are stimulating your pain fibers. I have a patient who has IBS. If she thinks about anything anxiety-wise, she gets severe outbreaks of her bowels. I mean, it's like that one. Again, talk about how the brain, the gut, and the adrenal glands are connected. It's big. All right, categories 10 and 11. This is your thyroid. And again, we talk about people can have 1s, 2s, and 3s in both category 10, which is hypothyroid, and category 11, which is typically hyperthyroid. And that's what's crazy. Is, hey, I have symptoms of both. Well, you know what? That's when we are thinking absolutely Hashimoto's. If you have a bad thyroid, you've got a bad brain. But I talked earlier about how the hormones are involved with your thyroid function. There's something called the hypothalamus pituitary axis, the HP axis. What you have to know is a part of your body regulates all your hormones. It regulates your thyroid, it regulates your adrenals, it regulates your male and female hormones. And if you have a problem with one, it's going to lead to a problem with the rest. So if you're on replacement therapy, HRT, hormone replacement therapy, it's going to down-regulate your thyroid, and your pituitary gland's not going to work as well. So that's why you got to be so careful with what you're taking. Now, I know a lot of you said this earlier. Let me get a show of hands. How many of you have been told that your lab tests are all normal? Sure. Okay. So they say nothing's wrong with you, but yet you don't feel well. You feel lousy. So what's going on? Either they're not running the right tests, and they don't run thorough enough tests. They run the bare minimum tests that insurance covers. So when you run the bare minimum tests, you get the bare minimum results. Or they're using traditional lab ranges. So what happens is, I use the same labs they do. I use Quest, I use Solstice, I use LabCorp, and I get a lab back, and it's got this reference range on it. That reference range is nothing more than statistics. So it's a bell curve. Who gets blood work done every month? What kind of a person? A healthy person? No, a sick person. So it's statistics. So if you look at the odds, all these numbers are going into this range. And then they're taking that and they're saying, okay, everybody who had blood work done in this year between 30 and 40, I'm looking at. That's a big population pool. And a lot of those people are not healthy because they're only going once a year. Otherwise, you're going every month maybe. So it's based on unhealthy people. And what that means is it's a pathological population. If you're inside of that range, congratulations, you're as healthy as everybody who's sick. We don't know. It doesn't tell us anything. If you're outside of the range, then definitely. You're outside of the statistical mean, there's a problem. In functional medicine, I use functional lab values. They've been published in the medical literature. I keep saying that. There's a reason why we go to research, because researchers are able to identify stuff without opinion. And they can look at fact and see what actually needs to be used. And we look at these functional lab values. And we're going to talk about TSH in a second, but I want you here. And you're going to see a lot of times, until you're in the L or the H, the lab high or lab low, your docs are going to ignore it. And even sometimes, this is the best, is they look at your labs, and they're thinking in their mind, well, it's off, but most people I see who's off, they're fine, so I'm going to ignore it. It's normally not a big deal. But it's an abnormality in your lab, and it gets ignored completely. So, TSH, I got to go over this one with you guys, all right? I'm going to give you two numbers. The first number I'm going to give you is a number that was put in place in 2003. 0.14 to 3.17. Okay? It was put in place by the clinical endocrinologists, the American Association of Clinical Endocrinologists. 8,000 clinical endocrinologists. They said the TSH range in 2003 should be 0.14 to 3.17. It was published in their journal if you want to look it up. Most labs give you a range of 0.3 or 0.4 to 5 and change. Now, 9 years ago, the endocrinology researchers said, use this range. The labs don't use that range. What do your doctors use? What the lab gives them. They're not looking at what, even the endocrinologists use this. They're not looking at their own research. Now, I can tell you in functional medicine, we use a range, and this is the range I want you all to know, 1.8 to 3.0. This is optimal. This is healthy. If TSH is not 1.8 to 3.0, then there's something not working right with your thyroid or pituitary gland.
So we can go back to our test results and check it out.
Yeah, that's what I do with you guys as well, absolutely. Your doctors are ignoring a key piece of the problem when they do a screening test and they do a TSH and they say it looks good. A large part of that is they're not running enough. But the bigger issue is they're not running all the tests. And again, we talked about this earlier. They run TSH, they run T4, but they ignore the rest of them. If you're going to run a thyroid panel, there are 7 tests that should be run every single time. TSH, total T4, free T4. That's what your body's producing. Okay, that's the main, or what you're taking in a hormone. Okay, and that helps regulate, so you can know what you're taking. And T4 and TSH do affect each other. So if you're on a medication and they keep going up and down with the levels, they're trying to balance TSH with T4, but what they're ignoring is all the rest of the equation. And free thyroxine index, that's how much T4 can be used. How about T3 uptake? How much T3 is being able to be brought up to be used by the body? And the big ones are total and free T3. So T3 is important because this is the active thyroid hormone, and it tells us conversion. It tells us if the body's using it. So there are people who have enough T4, but they feel lousy because the body's not turning it into the usable form. There are patients who have hormonal issues, and T3 is way off, or liver problems, and the T3 is way off. Even reverse T3, it's another one of those tests. The body's so smart. It's got an overflow valve built in. It's called reverse T3, and the body doesn't use it. It's like a throwaway. But if you have a hormone problem, if your estrogen levels are crazy, or if your body's messing up the system from either a pill or something that's going on with your hormones, your body's going to make more reverse T3, and the problem is it can replace T3, and so your body then stops using the T3 that's there. So if HRT, if hormonal issues are involved, then we have to look at that marker. Now, most of you probably have an autoimmune reaction in your thyroid. The way we look at that in lab work is through antibody testing. TPO and TBG is for Hashimoto's. And I've had patients that have had one test done, and it came back negative, but the other test wasn't done. When we ran it, it came back positive. You got to run both tests. It's called a thyroid antibody panel. And it's a standard test that can be run by almost every doctor, every office. But they don't run it because, you know what? If you have an autoimmune disease, are they still going to put you on Synthroid? Yes. They're not going to change what they do with you at all. They're not going to address why you have the autoimmune disease. TSH antibodies are Graves' disease. Now, I got to talk about these autoimmune conditions. They're not really thyroid problems. Now, they're impacting your thyroid. The immune system is mistakenly attacking it. But it's not a thyroid problem. It's an immune problem. You got to figure out why is your immune system attacking the gland. Where's that imbalance from? The way we're going to do that is through proper testing.
I first had hyperthyroidism.
Burns out your thyroid, then you go hypo. If they don't take it out themselves.
And the symptoms of that are horrible.
For some people, and I mean, again, obviously the biggest risk with hyperthyroidism is something called cardiac storm.
Yeah, I would just have bad pains and just, just
a heart attack is the number one concern with that.
Yeah.
But yeah, I mean, and it's funny because the main medication for hyperthyroidism is not a thyroid pill. It's a beta blocker. It's to help you prevent you from having a heart attack. That's all they do. And here's the thing: it's an immune problem, right? So we can impact and what I'm getting at with you, and I'm going to cover this at the end. But what I'm telling you is we can identify why your immune system is attacking your thyroid, and it can be fixed. I'm not talking steroids. I'm not talking suppressing. I'm talking correcting the immune imbalance. Now, I want to cover one more category, and then we're going to answer that. All right. So, categories, actually 4 categories, 14 through 17. These are your hormones, your sex hormones. Category 14 and 15 are male hormones. We're talking andropause, prostate disease. 16 and 17 are female hormones. 16 is cycling female, so infertility issues, menstrual cycle problems. 17 is going to be menopause, hot flashes. Patients who are postmenopausal 10, 20 years and still have hot flashes. That's not normal. There's something that's wrong with your system. If you've got 1s, 2s, or 3s in those categories, there's a problem that's going on that needs to be addressed. And the main reason why, blood sugar. That's the number one thing with hormones. I mean, that's huge. Insulin resistance. Adrenal involvement. Your adrenals can be fatigued, so your body's going to steal from Peter to pay Paul. The problem is everything just gets wiped out in the process. The thyroid can impact it. The brain can impact it. Remember that HP axis we talked about? So your hormones can be messed up from so many different things. But your web of dysfunction, and if you look at these sheets, these give you a clue as to where your problems are. You may have 6 of these things. You may have 15 sections that have positives. That's what's causing your autoimmune disease. That web of dysfunction is why you're suffering. And taking a pill like Synthroid is not going to fix it. It seems pretty chaotic. It seems like there's a lot to look at. There is. But the good news is that's why you have me. And there's an order that we look at stuff. And if I don't get these problems fixed, though, then you're never going to get better. And it's important that we address these issues. Number 1, do you have an autoimmune disorder? Again, we think we probably do. It may be that we can confirm Hashimoto's. Maybe we confirm that you have alopecia or psoriasis or some other autoimmune condition. Even glaucoma is they're showing that it's caused by autoimmune attacks against the cornea. So we're seeing all sorts of different things that the immune system can impact. Blood sugar, number 1 stressor in the body. It can affect everything. Anemias. When I say anemia, I don't mean iron. I mean red blood cell disorder. Iron could be involved. B6, B12. How about pernicious anemia? That's a big one that links with Hashimoto's. You may be tired. Your body may not be producing enough B12, or maybe attacking itself so it can't produce enough. I have patients that get B12 injections, and if they stop the injection, the levels are low again. Why? It's not because you're not getting the injection. It's because there's a process in your body that's attacking your ability to make B12 on its own. Inflammation. I'm going to take a blowtorch. I'm going to take it right up to your cells, so I'm going to turn it on. That's called homocysteine and C-reactive protein. It's inflammation in your body. Any immune response causes that inflammation. Gut function. We talked a lot about that. It's a number, 80% of your immune system is there. We know you have a problem. What type is it? Is it food sensitivities? Is it leaky gut? Is it infections? Is it stomach acid issues? Where's the problem coming from? With your thyroid, it's not just about production, but it's about the peripheral function, all those different areas that are involved with that. And, your lipids. Don't raise your hands, but if anybody has problems with libido, this is one of those things that, and I see this a lot, is libido issues, sex hormone issues, and they're on a statin drug. So their cholesterol levels are actually being really low. Cholesterol, fatty acids, make your hormones. They help your nerves function better. They're good. And this whole concept of cholesterol being evil, the World Health Organization just published the best number to live of cholesterol is 237. Yet, what do they want us? Under 200? Yeah, but 20 years ago, what do they want us? Under 230? Under 250? Why are they lowering the levels? Every few years, there's a big conference that gets set up. We're not going to go into that, but we know the conference is, we know what they're doing. Is, the number one drug that's sold, statin drugs. There's, and you talk about everywhere else in the world gets it, but we. If I'm going to help you, if I'm going to get your thyroid better, if I'm going to get your immune problem better, I have to identify what's driving it. You've got these antigens, these invaders. You've got these stressors. Your web of dysfunction. We find out what's driving it, and we correct it. And here's the thing. You have two halves to your immune system, Th1 and Th2, T helper 1, T helper 2, okay? When you get sick, a healthy person gets a shift, fights the infection, calms back down. In an autoimmune patient, you get a shift into dominance. Your immune system is driven, it's attacked, it's pushed, and it never calms down. We have to figure out if you're Th1 dominant or Th2 dominant. All cancers are Th2 dominant. 70% of Hashimoto's is Th1, but you can see things in between. And the key thing is, if you have this immune dominance, we have to make sure that we remove what's driving it. That's your web. But at the same time, we have to calm it down. We have to modulate the immune system. I use an analogy of a seesaw. My daughter's 6.5, and she's on one side of the seesaw, and the football player comes down on the other side. And you know what's going to happen to her. He plops down, she's going to go flying. The reason that happens is because that seesaw has a narrow base. Widen the base. That's your immune system. I want to widen it so it doesn't regulate abnormally, so it can balance and take what you throw at it. We do that, your immune system's going to be the way it's supposed to. Stop attacking your thyroid gland and balance itself over time. You may be taking supplements. Some of those supplements may be making you worse. I see patients that come in with bags of supplements. 25, 30, sure, yeah. It may be you. Sure, it's very possible. And I look at those supplements, and I see you're taking vitamin C and echinacea, and caffeine, and green tea, and grapeseed, and resveratrol. And you know what? I just named 4 things on either side that offset each other. Th1 and Th2. So if you're doing all that, there's immune formulas that have Th1 and Th2 stimulants in the same formula. If you don't know what your immune system's doing, you have no reason, no business pushing it the wrong way. You could be making yourself worse. We can't treat supplements as just a vitamin. We have to understand what they do in our body. And yeah, we use them as tools, and they are absolutely wonderful. I talked about the H. pylori infection. But you want to make sure that you're using what your body needs and only what it needs. And I use therapies in my office. Again, I talked about chiropractic neurology early on. We use treatments. We use oxygen therapy. We have different advanced treatments that help drive. I have a tool called a Reich machine. Google it if you want to. It's called an underground